My name is Salman Sheikh. I'm a pulmonologist and a sleep physician with Rush Copley Medical Group. Today's topic is about the sleep problems. The most common sleep problems in the general community include insomnia, feeling sleepy, excessively sleeping during the wake hours despite adequate night sleep, and problems with the legs where the legs don't feel comfortable, along with environmental conditions such as uh, job-related issues. Insomnia is defined as not being able to feel a restful sleep or inability to initiate sleep, and also not being able to maintain sleep. In addition, insomnia can also be defined as that if someone has slept fairly during the night, but once they wake up in the morning, they don't feel rested. And sometimes they feel that they had lots of interruptions. A couple of times of awakening each night is common in general population, such as waking up once or twice, as long as a person can go back to sleep without any difficulty. That's not considered part of insomnia. Sometimes patients may wake up in the middle of the night and not able to get back to sleep for a couple of hours. That is considered as a part of insomnia. The problem has to be defined into 3 months. The problem should persist for at least minimum of 3 months before it is defined as a disorder. Insomnia can also be due to depression, anxiety, personal issues, job-related issues, issues related to relationships, but that usually is short-lived. But if it persists more than 3 months, then it should be considered a problem. Insomnia usually is treated by addressing the primary problems, such as addressing anxiety, depression. Once anxiety and depression has is, uh, is associated, or in anxiety and depression, once insomnia develops, it becomes an independent disorder. Then treatment of anxiety or depression does not correct insomnia. So the insomnia has to be handled or treated separately. The way we treat it is with a program called cognitive behavior therapy, which it has different modalities in it. These are mostly um, education-based, hygiene-based approaches. And in most of the cases, uh, medications are added. Then we come to an issue where a person feels excessive sleepiness during the daytime despite having an adequate night's sleep or an interrupted sleep. The excessive daytime sleepiness, most common cause in general population is sleep deprivation. Due to loads of environmental stress factors and personal stress factors, people do not try to achieve adequate number of hours during the night. In general population, in order to feel well rested, adequate number of hours are considered anywhere from 7 to 9 hours. Some folks think that sleeping 4 hours or 6 hours is enough and they can function very well. As long as number of hours of sleep are not interfering with your wake hours, those generally are not considered a problem for that particular person. So sleep deprivation is the most common reason for excessive daytime sleepiness in the general population. Then comes medical conditions such as using medications for some comorbid medical condition. And in addition to that, sleep disorder called obstructive sleep apnea, in which a person stops breathing for several times during the night. Rarely in general population, narcolepsy is considered a reason for excessive daytime sleepiness. That usually occurs in young population, adolescent population, and that is accompanied by unresisted episodes of sleep attacks. In the general population, occupational related disorders can also cause problems with sleep, such as the night shifters or the evening shifters. It is called a shift work disorder. Especially the night shifters have a problem to stay awake during their shift. And when they are not able to stay awake during their shift, they try different means to stay awake, such as taking stimulants, such as caffeine or some over-the-counter medications to stay awake. If the shift worker disorders are not treated adequately, it can cause health-related issues and increases the risk during the occupation and also on the road. Now I would try to explain what sleep apnea is. Sleep apnea is not that common in general population. In men, 4% of the general population in men who are above age 60. Women premenopausal 2%. But once women reach 60, the prevalence becomes equal to men. This is almost always associated with snoring. You would observe a person during sleep that they quit breathing. The apnea lasts for more than 10 seconds and can happen several times during the night. As a consequence, the person feels tired, exhausted during the wake hour, and also sleepy enough to take naps. If it is untreated, it can cause hypertension, which is high blood pressure, also causes increased insulin resistance, which is later on can convert into diabetes. Also causes problem with control of diabetes, control of high blood pressure if it is severe. It's an independent risk of sudden death, stroke, and heart attacks. Also, the consequence of sleep apnea, such as not feeling rested, can increase the risk of road traffic accidents. There is another variety of sleep apnea, which is central sleep apnea, where the apneic episodes are linked to the breathing center. These are seen in patients with strokes, with heart failure, and use of certain medications. Sleep apnea is treated by first diagnosing the sleep apnea. Usually the bed partners would refer the patient, or somebody who has observed a person during sleep is referred. We send the patient to the sleep lab. Sleep lab is a kind of a nice environment where there is a bedroom along with which is in the sleep laboratory. It is monitored by the sleep techs. We put up sensors where we look at the EEG, which is the brain waves. Along with that, as the person sleeps, we can record the apneas. And that's how we come to determine the severity of sleep apnea. Once the diagnosis is made, we use a machine called a CPAP, which is called continuous positive airway pressure. The machine takes the room air, compresses it, and delivers the pressure, compresses it, and then delivers that air under pressure through a closed system where a person wears a mask and the pressure is delivered through the mask to keep the airway open. So this prevents apneas. That's how it is treated. Then we come to restless leg syndrome. Restless leg syndrome is pretty common in general population, especially the older they are, especially with iron deficiency anemia, where a person feels that there are tingling type of sensations, numbness, and strange sensations in the legs, where the movement of the legs makes the sensation go away. Iron replacement can treat it, and many of the times we have to use medications to treat it.